My name's Prima. I'm a dietitian. I'm actually from Brisbane. I've had 23 years experience and I've got two children of my own. One's 12 and one's 15. So I know the pure joys but also the sheer frustration of feeding children. So today I'm just going to take you through a few things, a couple of common mistakes that are made. Basically, by the end of this talk, you should be able to know what a serving size is, safety in food handling, the new guidelines, what to look out for, and just tips of filling in gaps when they do become a little bit fussy. So an overview of my talk today is just realistic expectations. Most people come into my clinic and say, my child's just not eating enough. By the time we actually work through what they're eating and compare it to the dietary guidelines, they generally are okay. But so I'll set your minds at ease with that. The feeding guidelines, they've changed in 2013. So what we used to say is restrict and delay things like eggs and nuts and dairy. We say no, around 6 months is when we should be actually bringing these into the diets. And this can be quite confusing and confronting to parents who have been used to restricting these things. The correct serving size, normal food behaviour, not enough or too much. How do we know if they really are getting enough of any nutrient? My 7 quick checklist. So if you can answer yes to at least 5 out of those 7, you are doing brilliantly. And safe food handling, because in this day and age, we're not doing that particularly well in how we store food and how we cook food. So the realistic expectations. In the first 12 months, your baby triples their birth weight. So they might be born at 3 kilos. By 12 months, they should be 9 kilos. And then they put on between 2 and 3 kilos every year. Now, in that second year of life, their appetite absolutely plummets because they don't actually need to put on so much weight. So by 12 months, this is a little bit of a standard, they should be enjoying the family meal. At 12 months, it should be adapted for salt, fat, sugar and intense spice, but you really can do something like a chicken casserole, can be fed to the 6-month-old, the 9-month-old, the 13-month-old, the 10-year-old and the adult. So we should be cooking just one meal by 12 months. Their stomach sizes are the size of their fist. A clenched fist is their stomach size. So they need 3 meals and snacks. They cannot get all their nourishment in just 3 meals. A lot of parents say to me, I restrict snacks, we don't snack between meals. That's actually the worst thing you can do because their appetite switches off. Have you ever been sort of, running through Westfield thinking, I'll just do this job, this job, this job, and then you think I'm not hungry anymore? We've got about a 20-minute appetite sort of lay period, whereas children can have 5 to 7 minutes. You know, when they say, I'm hungry, I'm hungry, I'm hungry, by the time you get home, they're not hungry anymore because the body's actually got an adaptive mechanism that switches off their appetite to use their stores. So the small stomach size, you need regular meals, and that's about feeding a child every 2.5 to 3 hours. So that helps to regulate their appetite. And if you're worried about their intake, keep a record for a week, because one day they might eat lots and lots of calcium-rich dairy foods, they might have some fruit, the next day they eat nothing, but over a week you tend to assess whether they're doing quite well. So the feeding guidelines include dairy, soy, wheat, fish from 6 months. Cow's milk as a drink needs to still be restricted till 12 months. So they can't drink cow's milk until 12 months, but you can put it in cereal and bake with it, like if you're making muffins and cakes. Eggs are now recommended from 6 months, and smooth peanut butter can be put on things like little Cruskets. If you sort of break it into 4 and put some peanut butter on there, that's perfect at 6 months as well. But consult your GP if you're worried about allergies. But restricting foods, we actually are seeing that it's probably not the right thing to do. We need to get these things into their diets. So an adult and a kid's plate. Well, I mean, our plates are enormous these days, but if you look at an adult's plate being the standard serve, a child's is about half that. So if you look at something like the carbohydrates, it's about 1 cup for an adult and it's about half a cup of rice for a child. So be careful that we don't put too much on their plate, because they can feel a bit overwhelmed. If there's too much on their plate, they'll push it away and they won't try anything. So a small serve, even if they don't, a lot of people say to me they won't have any vegetables. It may just be 1 pea on their plate or 1 little bit of carrot. That's a lot less daunting for a child to have that 1 pea. So what is a child's serve? So if you look at something like the breads and cereals, this is broken down. There's a wonderful little brochure at the back of the brochures on your chair, and you can all get one, or we'll be giving them out at the back at the end. This is from the dietary guidelines, and it tells you how many serves your children need from each food group per day. So if you're looking at the breads and cereals, it's about 4 serves a day. So if they have a little bit of cereal in the morning, which is about 2/3 of a cup of cereal flakes or 1 sort of cereal biscuit, or a piece of toast with an egg, that's 1. A sandwich, even if they have a 1 bread sandwich, a lot of parents say they won't eat 2 pieces of bread. They don't have that capacity in their stomach. So 1 bread is fine. And they might have a couple of little crackers with some avocado in the afternoon, and then half a cup of pasta for dinner at night. There's 4 serves, so they're well and truly getting their carbohydrate serves. If the meat and alternatives, this is probably one of the hardest groups to get into to children. When they start eating, if they're just having soft blended foods, they haven't developed their good chewing muscles. So meat tends to be a very, very difficult thing to try and get into them. But what you're trying to do is get 2 serves a day, where a serve is about a 30-gram piece of cooked meat, which is about that little bit there. So that is all you need as a serve that you're giving to them. But what I try and tell parents is try and get an egg into their breakfast. So if you make a piece of French toast or a little bit of scrambled egg, well-cooked egg, you've got at least one of the serves coming in, and then you only need half of that at lunch and half at dinner. So it's very small. It might be one little meatball, it might be one little risole. So it's just small serving sizes, you don't need a lot. A slice of roast meat, or if you don't have meat, half a cup of baked beans. So it's the little tiny cans of baked beans, but things like cannellini beans, butter beans, you can mix that with cream cheese or mix it with avocado and spread it on the sandwiches. Then you know you're getting a good quality iron and protein-rich meal into them, or 50 grams of cooked fish. So the dairy foods, this used to be 3 serves a day, which was 3 250ml cups of milk or yogurt or custard. Now that's dropped to 1.5 serves a day because we were developing these little milkaholics. And what they were doing is replacing their meal with milk. So it's 1.5 serves, where a serve is about 250 mils of milk, 200 grams of yogurt or custard that's very low in sugar, or 40 grams of cheese. So if you get 100 mils on their breakfast cereal and a little tiny tub of yogurt and a bit of cheese for an afternoon, you're well and truly getting those 1.5 dairy serves. The fruit is 2 child portion friendly serves a day, where half a medium piece of fruit. So 1 banana cut in 2 is their 2 serves a day. But you don't need that banana and then some more and then some sultanas, because what happens is they have too much fruit and that can upset little tiny tummies. They can get a little bit of loose bowel motions. So half a cup of canned fruit or a tablespoon of sultanas, not a whole box. That's actually 2 serves. And I mean, children who have a whole box of sultanas all at one time, they will land in the nappy undigested. So vegetables, these are about 5 serves a day, and this is the most difficult to get into children. This is 1/4 of a cup of cooked veggies is a serve for a child. So if you try and get 2 of those in at dinner time, or 2 of those in at lunchtime, and even things like some blanched carrots or a little bit of cucumber, those things can be in for morning teas and afternoon teas. Please don't leave all the vegetables and salad till dinner at night. Imagining us as adults having 5 cups of salad for dinner at night. We're never going to eat it all. We need to try and distribute it evenly through the day so they're not trying to have so much, because this is really high in fibre and it fills up those tiny little tummies very quickly. So fats and oils, this is 1 to 2 serves a day, where serving is about a teaspoon of avocado or a teaspoon of hummus with the oil, a teaspoon of olive oil. That can be just, as part of like a spread on breads or in their main meals. But that's just, that's also essential for their fat-soluble vitamins. So normal food issues. Who feels that they've got a fussy eater on their hands already? I can see a couple of little fingers going up. Food fussiness, 18 months to 3 years. We really need to sort of address the issue, but there's about 5 or 6 different types of fussy eating. Some children are really, really nervous of food. This is called neophobia. Some children don't know how to chew. Some children just like white food. They call it the white food diet. So there's so many different ones, and you've got to attach the right management plan. So they're also learning at this age the word no. And they like that meal that you gave them 2 nights ago, and they don't know what to call it, so they keep knocking back what you're trying to give them. Don't give in, and don't give in and give them a peanut butter sandwich for dinner at night, because then they'll think that's their learning curve and that's what they'll get used to. So you've got to keep putting things on their plate. Just get help if their food is dramatically reduced and you feel they're losing weight, or they're looking undernourished, or they're getting sick. If whole food groups are avoided, so if they do avoid the entire meat, chicken, fish group, you need to get some help to what to substitute to give them the nourishment, like the missing protein and iron. And if your parent-child relationship is strained, I had one parent once who said, it was like a battlefield and she hated meal times. And so that's really sort of interrupting that wonderful parent-child relationship. And also if they won't try new foods. What I say is children have different personalities, and you might know even in your own family, there might be one child that will just race down to the beach and dive straight into the water, won't even touch the water, will just dive in and think later. Another one will go and tip their toe in and think, oh, it's a bit cold, but I'll work my way in. One will have an absolute tantrum, won't go anywhere near the water. They're the different personalities, and you'll see that actually presenting in food as well. So some just eat and then go, no, I don't like it. Others won't even touch it. So we've got to basically address issues as they come up. So how do I know if they're getting enough? Your little books that you get home from hospital and they show you the growth charts, all babies tend to sort of start, very, very sort of like well-fed and greatly nourished, and then they sort of peter out and they get into a nice little routine. So even if your child is tracking well on the 5th percentile for height and weight, that's fine. Someone's got to be on the 5th and someone's got to be on the 95th or 97th percentile. So you watch their height and weight, but keep that food record chart for at least a week. Now, everyone knows we're saying let's get plenty of variety into their meals. What is variety? And my rule of thumb is try to get 15 different food types in every day. Now, before most of you have gone, 15? I don't even have 15. Think of something like cereal with a bit of milk and a tiny bit of fruit. Morning tea might be a cracker and avocado. Lunch might be a sandwich with a little bit of Vegemite and butter and maybe a piece of cheese. You're already up to 9. So it's not hard, you've just got to keep getting the variety. But a Vegemite sandwich for breakfast, a Vegemite sandwich for lunch, and a Vegemite sandwich for dinner, that's not variety. And you're going to have to dig yourself out of that hole. So what if their diet is not balanced? These are the sort of behaviours that I tended to pick up just to address to parents. Poor behaviour could be a lack of, like their blood sugars are dropping too quickly. And more often than not, it is something like maybe a honey sandwich without any protein. They just run out of fuel. Tired and irritable might be low iron. Recurrent infections, this is iron and zinc. This is what runs your immune system. So if your child is still sick after a week, they might be very low in iron. If they're constipated or they've got diarrhoea, it could be either too much fibre or not enough fibre, or the balance of fibre is actually out. Or poor growth and development, just not enough fuel. So tips for filling in the nutritional gaps. Biggest problems is your meat and your fruit and vegetables. Use things like eggs or hummus or legumes or baby rice cereal that's been fortified with iron, or a toddler milk supplement, just to fill in the gaps of the iron and the zinc and the protein. So you can use those things, as I said, like the white cannellini beans, or if you're making pikelets, using the toddler milk when the recipe calls for a cup of milk, that actually fills in some zinc and iron when you're making your pikelets. Fruit and vegetables, this is fibre and vitamins that they might be missing out on. So again, use your legumes, your wonderful baked beans or red kidney beans or chickpeas. If you puree things, last night's bolognese goes very nicely on crackers or in sandwiches. And they've tasted it the night before and you've got all those wonderful vegetables in there. But you may need a fibre supplement under the guidance of a medical specialist just to help move those bowels and get things going. And if they're not having dairy, they're missing out on maybe protein and calcium. So using cheese or cheese sauces, yogurt dips, home bakes with milk powder or toddler milk. So trying to get a white sauce over the top of vegetables or in a lasagna. So my quick 7 checklist. As I said, if you can tick off 5 of these, you're doing brilliantly. 7, well, you don't need any help at all. So you've got to basically see, are meal times regular? So if you are basically giving your child every 2.5 hours something to eat, you're doing well. Are they sitting in a high chair or the table? 90% of the time, children actually they choke because they're running around with food in their hands. Try to establish a wonderful little area for them to eat at, or sitting up at the table with you, because these are fantastic dinner time rules to learn. Are they enjoying the family meal? Are we all eating the same meal? Because I tend to watch mum and dad, and what I say is, generally, if dad doesn't eat his greens, your children are never going to eat their greens. I've seen some women at the moment and are looking at their husbands like this. Please eat your greens. Are they having healthy snacks in between meals? Don't fill them up on sugar or just plain biscuits, because you need to make those snacks nourishing. And are they eating meals, are you having to bribe them with distractions? If you hear my voice, if you eat your dinner, you can have some ice cream. What is your child going to hear? They're not going to hear, I don't want to eat this dirty old dinner. I want this lovely ice cream. You've got to change it to say, once you finish your dinner, we can go and read a book. So the inflection of your voice goes down rather than trying to elevate, desserts and treats as the high level. And are they trying new foods? Just try and put a few new foods on their plate. Look, I've been guilty of this. I didn't realise my daughter liked rock melon until she was probably around about 6 or 7 at a party where she was just gobbling it down, because I don't like rock melon. And that's okay to have your likes and dislikes, but try and not let your taste buds interrupt their their choices as well. And do they eat something from each group? That's why you use something from this. And if they are eating something from each group, they're getting a little bit of variety, but just try and keep expanding on that. So practising food safety, I'm very passionate about this, because sometimes the way we actually store, cook and freeze foods can have an impact on bacterial growth. And so you get people coming to see you saying, look, they've got a little bit of loose bowel motion. They're not allergic to any foods, it's just they're actually reacting to something in the food. So it's safe temperature, safe handling and safe storage. So the safe food temperature is, look at this, your basically your fridge is below 4 degrees. So below 5, in that sort of 0 to -18, bacteria won't grow. So your temperature, your danger zone is that 5 degrees to 60 degrees. This is that lovely temperature sitting on the side of your kitchen bench. So if things are sitting out there for long periods of time, every hour you get this huge bacterial growth. Above 60 degrees, so that's when you put your finger right in the centre to test it, it is burning your finger. So 60 degrees, 100 degrees is the kettle, but the temperature when you put it in the microwave should be above 60 degrees. Make sure you stir it very, very well so there's not any little cold patches that haven't been cooked. So your food is actually steaming, and that's above 60 degrees. So thoroughly wash your hands before you touch any food and prepare any food. Wash foods such as fruits and vegetables because they've actually been through possibly about 10 different hands before you pick them up. And I still see people roaming around fruit shops, picking the grapes off and popping them in the mouths. And I think, gee, I hope that's okay. And I hope they've washed their hands. Thaw frozen foods in the fridge. So plan your meals. Get your food out from the night before if it's frozen and put it in the fridge and let it overnight thaw. Trying to thaw it very quickly on the bench top is not great. And discard any used food that has been in contact with saliva. We've got an enzyme in our saliva that starts to break down carbohydrate. So anything with rice, pasta, potato, breads, etc. When you put the spoon backwards and forwards from Bub's mouth into that, it'll start to digest it. So if you put a lid on it and put it in the fridge, it will get digested in the fridge. So discard any food that has got saliva in it. And please don't lick your children's spoons. Or even like they say, big mushy kisses on their lips and things, because we do transfer bacteria from our mouth into children's mouths. So just being careful. So safe food storage, name and date the foods to be frozen. We've all been guilty of pulling something out of our freezer thinking, I don't even know what that is. Like it looks green or it looks frozen. So name and date what you've actually frozen. And things really should be discarded after about 3 months. So if you haven't eaten it, it shouldn't be up to sort of like, dinner time roulette, which is bringing things out not knowing what they are. Use well-sealed containers to stop any sort of bacterial transformation. Cool foods before freezing them. The worst thing you can do is put a boiling hot meal into the freezer. You'll freeze the very outside, but it'll stay hot for hours and hours and hours, even in the freezer. Let it come down to room temperature, then put it in the freezer. It'll freeze a lot quicker. So don't put a boiling hot meal in the freezer. Thaw your meats on the bottom shelf of the fridge to avoid drips into the food. So meats always go down to the bottom. And use insulated packs, especially for little lunches going off to schools. So as I said, these should be on your chairs. If not, please come up and grab one because I've got a whole pack up here. They've got lots of lovely information, but this guideline, which is very, very handy, and you can cut that up and keep it and laminate it. We've also got samples. As I said, one of us have got some samples of the toddler milk if you wanted to try a little bit of cooking, using it as you would replace some milk. And I'm also available on stand 011, so 011. So, 011 for the next hour or so. I'd love to answer any questions you've got on allergies, safe food handling, foods that your children are not having, fussy eating, picky eating, or even your own diets. So please come and see me.